Hello everybody, welcome back to the channel. In this video we're going to be reacting to every tool that a plastic surgeon uses. Let's get right into it.
Dr. Lara Devgan. I'm a board-certified plastic surgeon, and these are some of the most commonly used instruments in my operating room. This isn't even really all the instruments. This is like a fourth of the instruments for every surgery, but at least then I'm like saying the main stuff. The first things that I'm going to show you today are one of my favorite aspects of my job, which is the scalpels. And so I brought my banana from lunch, and I'm going to demonstrate these knives for you. This is a 10 blade, and you can see that the belly of a 10 blade is broader and more curved. So I'll frequently use a 10 blade for an operation like an abdominoplasty or a tummy tuck.
An abdominoplasty, also known as a tummy tuck, is a procedure that removes excess skin and excess fat from that stomach to help tighten up the abdominal muscles.
Or I'm making a large and swift incision. This is an 11 blade, and as you can see, it has a very fine and sharp precision point that goes all the way to the tip. So it's much more appropriate for tiny little precision cuts, like for a blepharoplasty or a lip lift.
Blepharoplasty is removing excess fat, again, skin, muscle, whatever that may be, above the eyelids. Sometimes you get droopy eyelids as you get older. That kind of repairs that by removing those types of things to make the skin around them tighter, excess skin, muscle, and fat.
My favorite and most frequently performed operation is the facelift. I like to use an 11 blade for a facelift because it's a super precise operation. So I'll start by making a curvilinear incision hidden inside the ear and curving behind the back of the ear, and a little one underneath the chin. And I use those incisions in order to dissect the deep plane of the face free from the soft tissue of the face and the neck. In order to do that, I'm using a series of scalpels, small fine curved scissors, and larger curved scissors in escalating sizes. And this is one of the most amazing instruments in all of plastic surgery. It's called the Gourny Scissors or the Facelift Scissors. So they're inserted right here all the way into the face. So it's very cool, but very high stakes. And when the Gourny scissors are used appropriately, this pair of scissors can move freely, exactly how I'm holding it. From here, all the way down here, through the neck, all the way over here. And you can really literally separate someone's face from the deep structures below it, and separate someone's neck from the deep structures below it. So
it seems kind of graphic, of course. I think it'd be really awesome to perform that, but man, watching her kind of curve her, I don't know, forceps scalpel through her face, obviously mimicking it, is kind of weird to see. It kind of makes me wince. Not really cringe, but yeah, it's just weird to think about. But obviously there are a lot of important structures. There's a lot of important nerves, vessels, stuff like that in your face. Trained professional, obviously doing something as important as a facelift, but man, that's pretty crazy.
This small pair of scissors really represents the pinnacle of what is possible with plastic surgery in understanding the key anatomy of the face and how to do good and not harm with it.
What is the tiny rake for?
The tiny rake?
Yeah.
It's called a rake, actually, or usually a sen more formally. So this little retractor is often used in a facelift to lift up tissue planes to allow for better visualization. These fine and beautiful instruments here in front are some of the instruments that I use for blepharoplasty. First, I use corneal shields to protect someone's eyes so that we don't get corneal scratches or irritation when we're doing the surgery. Next, I use these millimeter calipers to precisely measure the fine details of the operation, because you want to make sure that not only is the lid margin length the same on both sides, but that one eye is exactly the same as the contralateral eye. So the calipers are an elegant take on a millimeter ruler that is sterile and prepared for the surgical field. After planning and making my incision line, I use an assortment of fine surgical scissors, like iris scissors, in order to dissect out excess skin and puffiness from the upper lids and from the lower lids. When I'm using the lower lid incision approach, I use instruments like this specialized Damar retractor to get placed inside the lower lid to retract out the tissues in here to better visualize puffiness and excess fat under the eyes.
I have a slight problem putting eye drops in my eyes just because of sensitive and weirdness, and I don't really like things touching my eye that shouldn't be in there. So man, and I know you'd be under, you wouldn't probably be awake or at least not feel it, depending on the kind of anesthesia that they use to put you under for that kind of procedure. I have no idea what that is. But man, putting something, a little hook kind of in your eyes, a retractor, again, kind of makes me wince. Not really cringe, but it's just, that is something that doing it if you were awake, I think would be absolutely terrible, kind of like a torture device, but obviously something that's necessary in a surgical room and stuff like that.
The skin around the eyes is the thinnest and finest on the body, and for that reason, the instruments that we use to close the tissues around the eyes are also some of the very finest that we use. And I love these instruments because they're so tiny and adorable. These are jeweler's forceps, and these are very fine needle drivers, and they're both very tiny in caliber. And these are the instruments that I use to handle a needle and suture when I'm sewing closed the incision line for an upper and lower eyelid blepharoplasty surgery. You may have noticed this interesting collection of instruments right in the center of the table, and these are some of the instruments that I frequently use for rhinoplasty surgery.
So rhinoplasty is obviously a very common procedure that's done all across the world in plastic surgery and stuff like that. That is to change the shape, the contour of the nose. Should dive more into it, but pretty much just a nose job, rhinoplasty.
We'll start by using the nasal speculum, and this goes inside the nostril and it allows me to visualize what's going on the inside. And when we're looking at the nose, some of the things that I address aesthetically include issues related to the contour, the dorsum or bridge of the nose, and the tip. When someone has complaints about the bridge of the nose, often they're related to bumps on the nose. And one of the ways that we address bumps is with rasps. And these are kind of like the equivalent of surgical nail files. The ridges on the rasps are actually coated with diamond dust. So they're extremely sharp and they're capable of filing down bony and cartilaginous humps on the sidewall.
Cartilaginous obviously meaning cartilage, just kind of the adjective form, I guess, of that. Cartilaginous humps is what she said, or bumps. Man, a nail filer for bone, that must be absolutely insane, obviously, to take a little file and literally break down the nose in order to give you that contour and that shape of the dorsum or the bridge that she said. That's absolutely crazy. Coated in diamond dust too.
Walls of the nose to make them narrower, and the dorsum of the nose to make the prominence right here a little bit more refined. In some situations, rasping the nose is not enough to give someone the contour they desire. We sometimes need to infracture the nasal bones and reduce the size of the nasal bones by breaking them. And that's called performing an osteotomy.
So an osteotomy, also known as bone cutting, is when a surgeon removes or sometimes adds a piece of bone near a damaged joint. So in this case, she's doing an osteotomy for a rhinoplasty, removing part of that bone in the nose in order to give you a different kind of shape.
We use a mallet and an osteotome. So in order to create controlled breaks of the nasal bones, I actually create postage stamp little breaks along the side walls of the nasal bones using the mallet and osteotome. And we do that just like that. Tap, 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 tap. By making little osteotomies all the way down the nasal bones on both sides and infracturing the nasal bones. So this is a very interesting and unique instrument. It looks a little barbaric, but it's actually incredibly controlled in precise hands with very controlled, precise movements.
In a video by Kevin Jabal, who is a plastic surgeon resident dropout, now running Med School Insiders, that page on YouTube, did a video where he talked about how precise the plastic surgery was because of how cosmetic it was. And it seems like there's a lot of things like neurosurgery that people think are really precise, but in that case, as he said, it's kind of more brute, kind of like orthopedics, where it's a lot more, breaking, fixing, that kind of thing. Whereas plastic surgery, because it's kind of cosmetic along with dermatology, is really precise and fine, refined, I should say, because of how you want things to look, you want it to be precise, look good, hide scars, have a nice contour, shape, stuff like that. There's a lot of things that need to go into it when you're trying to give somebody the best outlook cosmetically that they want.
One of the most commonly performed plastic surgery procedures in the United States and in my practice is breast augmentation, and this is what a breast implant looks like. So this is a sample of a highly cohesive silicone gel breast implant. It's very squishy and feels very nice and natural. We place breast implants with a no-touch technique. So the incision used to place a breast implant is very small. It's about 2 centimeters, so less than an inch. It's placed in the inframammary fold just underneath the breast crease, so right where an underwire sits on a bra. And I use this funnel because it's almost like an icing funnel when you're decorating a cake, and it allows me to propel this implant through a very tiny incision right into the breast. Liposuction is a very hot topic, and I wanted to show you some liposuction cannulae. So this is a spatula-tipped cannula, and this is basically a stainless steel surgical straw used to suction fat out of the human body. These cannulae are used specifically for the submental region, so the double chin accumulation of fat. But liposuction can be performed in any area of the body. There are many different cannulas that are available, and I use liposuction cannulae that have a variety of lengths, calibers or thicknesses, and sizes. There are also many different shapes on the heads of the cannulae, so they can have a smooth tip, a round tip, a basket tip, a spatula tip, cutting tips, blunt tips, and many different types of tips. Now we have to talk about one of the most important tools in a plastic surgeon's toolkit, and that is sutures. This is a little close.
I have one of those kits at the bottom. Here would be my needle drivers and forceps and stuff like that. And here is my practice silicone pad. You can see my terrible attempt at making a suture line. I followed along a video, click up in the corner, and I will link that video. Trying to learn how to suture. Looks a little better at the bottom here. You can hardly see that line, whereas my first couple tries up top here, those were a little different. So I don't know if you actually were able to see that, but that's pretty much the kit that she's going to discuss. I should probably use that thing more.
Look at a 6/0 nylon. It's a very fine surgical suture, finer than a human hair. And you may remember these two instruments that I mentioned earlier. This is a jeweler's forceps and a fine needle driver from my Blepharoplasty surgical instruments. So there are many types of sutures that are important in plastic surgery, and there are two main categories of sutures: dissolvable and non-dissolvable sutures. And dissolvable sutures are used in areas where wounds are a little bit more forgiving, and non-dissolvable sutures are important in more cosmetically sensitive areas. So if something is very precision oriented, you're going to use a non-dissolvable tiny stitch.
Gosh, she makes her line so perfect. I know she's got a ton of practice. She probably does this 10 times on the daily, but oh my gosh. That's pretty much it. Shout out to Insider and Dr. Lara Devgan for doing this kind of video. No way affiliated, but thanks for the awesome ability to react to it. Thanks for posting that awesome video. Definitely check that one out if you want to watch the whole video or without any cuts. I will link that in the description below. I've got more days in the life, week in the life, study with me, stuff like that. I'm also applying to medical school. Have a whole video coming out on that, so definitely you don't want to miss it. Subscribe to the channel, like the video if you did enjoy it, and I will see you all in the next one. Peace.